Welcome to my channel. As the pregnancy progresses, the size and shape of the fetus grow, and similarly the size and shape of pregnant mother's belly also increase. The size and shape of pregnant mother's belly are different during pregnancy. Some women may see their bellies grow earlier and some women show them later. Many people complain to me that despite conceiving at the same time, their belly is smaller compared to other women. Many also said that they are 4, 5 or 6 months into their pregnancy but their belly is not showing yet. In today's video, I will discuss with you number 1, when does the belly start to grow during pregnancy? Number 2, what are the reasons for the belly to look smaller or bigger during pregnancy? Number 3, what should be done if the belly is smaller or bigger during pregnancy? So let's get started. Before that, we need to understand some basic concept. Why does the belly appear large during pregnancy? Look at the picture. It shows the two bones of our pelvis connected. This part is called pelvic cavity or pelvis. Typically, the uterus is situated within this pelvic cavity. When pregnancy occurs, the baby starts to grow inside the uterus. Sign there is not much space in the pelvic cavity as the baby grows. The uterus begins to rise from the pelvic cavity upward. As it rises, the size of the belly increases. That is when we notice that the belly is getting bigger and the baby is growing. When does the belly start to grow during pregnancy? The 9 months of pregnancy are divided into 3 parts. Number 1, first trimester pregnancy. The first 3 months or up to 13 weeks of pregnancy are called the first trimester. Number 2, second trimester. The period from the 4th to 6th month or from 14 to 27 weeks of pregnancy is called second trimester of pregnancy. Number 3, third trimester. The last 3 months or from 28 to 40 weeks of pregnancy are called the third trimester. Typically, the belly starts to grow between 16 to 20 weeks of pregnancy, which is during the second trimester. However, it is not necessary that everyone's belly grow at the same time. This is just an average estimate. Most women may notice their belly growing a few weeks before or after this period. Some may even notice their belly grow as late as the 7 month or 29 weeks of pregnancy. In the first 3 months of pregnancy, the size of the fetus only a few centimeters and weight about 15 to 20 grams, which does not cause any noticeable change in the belly. Now let's discuss the reason why the belly may not show during pregnancy. There are several reasons why the belly might not show during pregnancy, some of which are natural, while other could be due to medical conditions. First, we will learn about the natural condition. Number 1, first pregnancy. Generally, those who are become mother for the first time experience a relatively smaller and later growth in their belly. Our belly has muscles that support the internal organs. For the first time mothers, these muscles are typically strong, making it take more time to slightly enlarge uterus to stretch the muscle forward. This delay in muscle expansion may give the impression that the belly is not growing. That's why women who regularly exercise may experience slower or less noticeable belly growth. Conversely, for those who have second or third pregnancies, the belly muscle tend to be less firm since they have already been stretched during the first pregnancy. That's why even a slight enlargement uterus appear more prominent from the outside. Number 2, age. The age at which you conceive can affect the size of your belly. Younger women tend to have firm abdominal muscle, resulting in later and comparatively smaller belly growth. In contrast, the women who conceive at an older age generally experience large belly growth. Number 3, number of babies. If you are carrying one baby, your belly will typically be smaller compared to those who are carrying twins or multiple. Number 4, height. Generally, taller mothers tend to have smaller look bellies, while shorter mothers tend to have comparatively large look bellies. Number 5, weight. Mother who have a lower body weight or less body fat generally experience a smaller and slow growing belly during pregnancy. On the other hand, those with a higher body weight or who already have a large belly often have more abdominal fat. As a result, even slightly enlarged uterus can make the belly appear large. It is not that their baby is growing large than normal, but the presence of abdominal fat makes the belly looks bigger. Now let's discuss the medical reason. Number 1, amount of amniotic fluid. During pregnancy, the baby is inside a water-filled bag called amniotic sac, and the fluid is known as amniotic fluid or liquor. These fluid protect the baby from all kinds of injury from the outside. If someone has a low amount of amniotic fluid during pregnancy, the belly will appear relatively smaller. This condition is medically termed oligohydramnions. Conversely, if there is an excessive amount of fluid, it is called polyhydramnions. Those with more amniotic fluid will have a large look belly. Both conditions, too little or too much fluid, are dangerous for the baby and the mother during pregnancy. In such a case, it is crucial to seek advice from a gynecologist. Number 2, baby's weight. If the baby does not grow properly or gain normal weight for any reason, there is a problem with overall growth and development. The mother's belly appears smaller. This condition is known as intrauterine growth restriction. Many women are unable to eat enough nutritional food during pregnancy, resulting in poor development of the baby. On the other hand, if the baby gains excessive weight, the belly will naturally appear large. This is particularly common in mothers with diabetes, as their babies tend to gain more weight. Additionally, some mothers may eat excessively during pregnancy, leading to increased weight and large belly. In some cases, if there is a tumor in the uterus along with pregnancy, the belly will also appear comparatively large. What should we do if the belly is smaller or larger during pregnancy? Number 1, stop comparing your belly size with others. Every pregnant mother's bellies are different. Comparing can create unnecessary doubts and concerns. Number 2, according to the World Health Organization, a pregnant mother should consult a doctor at least 4 times during pregnancy. It is recommended to have checkup and ultrasound at the first 10 to 12 weeks, second 20 to 22 weeks, third 28 to 29 weeks, and after 36 weeks of pregnancy. If the ultrasound shows that the baby's weight, amniotic fluid, and other factors are normal, there is no need to worry about the size of the belly. Number 3, avoid overeating and ensure consume nutritional food regularly. Number 4, engage in regular exercise. Number 5, if you feel any discomfort or have any concern, consult with your gynecologist. No more today. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel for get health advice, health awareness, and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.